Hi, myself Dr.UMARANI came with a video on revision of lower limb through very important points present in the lower limb. Here I am going to give nearly 100 important points in lower limb. Do not miss till the end. It will be useful to solve MCQs for all entrance examinations. Commonest fracture in the lower limb. The answer is fracture neck of the femur. Most commonly dislocated bone in the lower limb is patella. Most commonly injured nerve in the lower limb is common peroneal nerve. Most commonly used nerve in the body for grafting, that is the sural nerve, which is formed by tibia and common peroneal nerve fibers, and it supplies to the lateral aspects of the ankle and foot. Most commonly used vein in the body for grafting is great saphenous vein, also known as long saphenous vein. Commonest site of venous thrombosis in the body is at deep veins of the lower limb. Longest muscle in the body is sartorius, also known as the Taylor's muscle. Thickest nerve in the body is the sciatic nerve, and longest, strongest bone in the body is femur, and largest sesamoid bone in the body is patella. Strongest ligament in the body is iliofemoral ligament. Strongest tendon in the body is tendocalcaneus, also known as the Achilles tendon. Commonest fracture of the tibia is at the shaft of the tibia at the junction of the middle one third and lower one third. Largest nutrient artery in the body is nutrient artery of the tibia. Largest and strongest bone of the foot is the calcaneum. It is the first tarsal bone to ossify. Shortest and strongest metatarsal bone is the first one. Longest metatarsal is the second one. Longest muscle in the body is the sartorius. Largest branch of femoral artery is known as the profunda femoral artery. Kicking muscle, also known as the rectus femoris. Commonest site of intramuscular injections in the thigh is that at the anterolateral aspect of the thigh in the vastus lateralis muscle. Longest cutaneous nerve in the body is the saphenous nerve. Main extensors of the hip during walking is hamstring muscles, also known as posterior compartment of the thigh muscles. These are semimembranosus, semitendinosus, and biceps femoris. Thickest nerve in the body is again sciatic nerve. Most difficult peripheral pulse to feel is the popliteal pulse. Which artery most prone to aneurysm in the body is the popliteal artery. Popliteal aneurysm is the commonest one. Largest muscle in the body is the gluteus maximus. Key muscle of the gluteus region is known as piriformis. Most common dislocation of the hip joint is at posterior aspect. Weaver's bottom is known as inflamed and enlarged synovial bursa between gluteus maximus and ischial tuberosity. Normal neck shaft angle of the femur, also known as angle of inclination, is 120 degrees in adult and 160 degrees in children. Chief muscle of the anterior compartment of the leg is tibialis anterior. All the muscles of anterior compartment of leg rises from the fibula, but tibialis anterior which arises from tibia. Most superficial and strongest dorsiflexure of the foot is the tibialis anterior. Unique feature of the lateral compartment of the leg is it does not have any its own artery. Bursa unsirene means it is located at the upper medial aspect of the tibia, that is tendons of sartorius, gracilis, and semitendinosus at their insertions. So all these three muscles together known as the gyropes. So gyropes in steadying the pelvis are known as three muscles. Largest compartment of the leg is posterior compartment, also known as the calf muscles. What is called peripheral heart? Soleus muscle is called peripheral heart. Most powerful tendon in the body is tendocalcaneus. Muscles functioning as organ of proprioception in the leg is plantaris muscle. Freshman's nerve, also known as tendon of plantaris, because it can be mistaken for a nerve because it is a tendon, but it mistakes as a nerve. That's why called freshman's nerve. Workhorse of plantar flexion of the foot is soleus. All the muscles on the back of the leg are long except popliteus muscle. Podiatry. It is field that deals with the study and care of the foot. Most common hind foot clinical problem. It is plantar fasciitis. Most important factors in maintaining the transverse arch of the foot is tendons of peroneus longus and tibialis posterior. Most vulnerable part of the medial longitudinal arch is talocalcaneo-navicular joint. Most vulnerable part of the lateral longitudinal arch is calcaneo-cuboid joint. Keystone of medial longitudinal arch is talus. Keystone of lateral longitudinal arch is cuboid. Commonest deformity of the foot is talipus equinovarus. Most important muscle to stabilize the knee joint is quadriceps femoris. Means that four muscles, that is rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Most frequently injured joint in the lower limb is ankle joint. Key muscle of the knee joint is the popliteus. Unhappy triad of the knee joint is known as injury of the tibial collateral, medial meniscus, and anterior cruciate ligament. Most commonly injured meniscus of the knee joint is medial meniscus. Most important ligament for maintaining the arches of foot is spring ligament. Longest vein in the body, great saphenous vein. Most preferred site of venesection or cut down is that great saphenous vein in front of the medial malleolus. Varicose vein is known as the dilated tortuous vein. Commonest cause of swelling in the sublingual area is known as inguinal lymph nodes. That is lymph node of Clarkett or Rosenmuller. Most of the lymph from the lower limb is drained into lower vertical group of superficial inguinal lymph nodes. Vein of Leonardo da Vinci posterior arch vein, known as a tributary of great saphenous vein. Commonest cause of varicosities of veins in the lower limb is incompetence of the walls in perforating veins or superficial veins or both. So these are very important points present in the lower limb. These points are helpful to solve the MCQs for that all entrance examinations. Thanks for listening.